Disc replacement surgery is a new alternative that's really, I say new, but it's been in development and begun being used since about 2000 when the first one was implanted in the US. It's become sort of accepted as of about 2010 as a pretty good option for an alternative to fusion. Now, the most common reason to have a cervical arthroplasty is a patient has a herniated disc in their necks, which is a soft piece of disc that's pushed off backwards and towards one of the nerves that goes to your arm. So those patients will commonly come in with arm pain, sometimes arm pain that makes them want to put their hand over their head or tilt their head off to the side to avoid that shooting pain into their arm.
For about a year, I kept feeling like I had a pinched nerve in my left arm off and on. Nothing I couldn't live with, and I thought maybe I was sleeping on it wrong, and then some days there weren't issues at all, but that lasted off and on for about a year. And then we moved into a new house just before Christmas, and one morning I woke in the middle of the night in just severe pain. It was my left arm only, it wasn't even my neck. It was my left arm and the muscle here and the muscle down here, some tingling in my fingers. It's very strange. And I thought, again, that I had just slept on it wrong. And then it proceeded to just get worse and worse. I wasn't sleeping no matter what position I was in. I couldn't sit up for very long periods of time.
Sometimes the herniated disc can be older, like a disc that's degenerated and collapsed a little bit with some bony narrowing where that's happened over a longer period of time. They're still good candidates for an artificial disc, but the most common is that soft piece of disc that comes on suddenly and gives you a sudden onset of weakness in your arm.
I couldn't sit up, so trying to drive, I could not. When I wanted to turn, I would have to turn my whole body. Just sitting hurt significantly. And of course, trying to feed the dogs and bending over, trying to shower, trying to put on my pants, and my daughter was helping me do that for a while.
We've been able to show that, in fact, there is a significantly less incidence of adjacent segment degeneration, so the level above and the level below don't wear out as quickly. And we can certainly get the patients back to their activities more quickly and get them recovered more quickly. So the patient's recovery is better, their symptom relief is every bit as good, if not better, and they have less risk of needing another surgery down the road. So for a lot of reasons, there's a big advantage to cervical arthroplasty, we call it.
The artificial disc it makes you back to normal. You know, you have full range of motion, and it was a very easy recovery. I had a surgery on Friday, stayed overnight, and then by Monday, I wasn't on any pain medications. I don't like them anyway, but I was able to be off of them. And it took a while to get my range of motion and things back, but from a pain standpoint, I was in so much pain before the surgery, and the moment I woke up, the pain in my arm was gone. It was amazing results, and now I can get back to normal, and if I need to pop up and go, or if I need to feed the dogs, I can shower on my own. That's very nice.